Hello, my name is Ashley Booth. I'm a student at Nightingale College, and I will be performing a head-to-toe assessment. Prior to entering my patient's room, I will have washed my hands and donned my gloves. I will knock on the patient's door and introduce myself. Hello, my name is Ashley. I will be your nurse today. Can you please verify your first and last name and your date of birth?
My name is Danny Vang. Birthday is May 27, 1992.
Okay, Mr. Vang, how old are you?
31.
Okay, patient appears to be stated age. And upon palpation of his skin appears warm, dry, and intact. Mr. Vang, do you know where you're at today?
I am at the hospital.
Do you know what day it is?
Today is Tuesday.
And do you know what city you're in?
Fresno.
Okay, patient is alert and oriented ×3, GCS at 15. Mr. Vang, I'm going to be performing a head-to-toe assessment on you today, assessing from the top of your head down to the bottom of your feet. Is that okay?
Yes.
Okay, I'm going to go ahead and begin my assessment with my gloves on. I will start at the head, and I will start by assessing for any lumps, bumps, or infestations. Okay, there does not appear to be any lumps, bumps, or infestations. I will check behind the patient's ears. Okay, no skin breakdown noted behind the ears. I will be assessing in each eardrum. Okay, left eardrum is clear. Right eardrum is clear as well. Okay, Mr. Vang, I'm going to have you just look directly at me. Patient's face does appear to be symmetrical. I will now start with my pen light, and I'm going to have you follow my pen light. Okay, eye symmetry is normal. Patient follows bilaterally with both eyes the pen light. I will now assess and simulate that I would be shining the pen light in the patient's eyes to check for pupil reaction. Okay, pupils are equal, round, and reactive to light, 3 millimeters in size. I will now be assessing the nose. I will palpate the nose to check for symmetry. Okay, I will now be assessing inside the nares. There does not appear to be any deviation in the nares. I will also at this time palpate the sinuses. Any pain when I push here?
No.
Okay. Mr. Vang, can I have you go ahead and occlude one nostril, breathe in and breathe out? Okay, breathe in and breathe out. Okay, do you feel like you can breathe in easier in one nostril or the other?
No.
Okay, how's your smelling?
It's good.
Okay, no issues with smelling senses?
No.
Okay. Patient, upon rest, his chest does rise and fall equally. There does not appear to be any barrel chest. Can you go ahead and smile for me? Okay, and go ahead and open your mouth. Stick out your tongue and say ah. Okay. Tonsils and uvula are intact, no redness or lumps or bumps notated. Lift up your tongue for me. Okay. Oral and buccal mucosa are both moist and pink. Teeth do appear to be symmetrical as well. I will now go ahead and palpate the lymph nodes. Any pain here?
No.
Okay, I will be assessing the trachea. No deviation in the trachea. And at this point in time, since I'm at the head, I will be assessing bilateral temporal pulses. Okay, and I would be assessing each pulse for 1 minute. Patient does have equal bilateral pulses in both temporal lobes. I will now be performing a whisper test on the patient to assess for his hearing. I will whisper behind patient's left and right ear, and if he is able to hear me, I will have him raise the hand on that side. Green. Green. Okay. Patient has equal hearing bilaterally in both ears. I will now be performing the Weber test. I would simulate that this is a tuning fork and have it vibrate on the center of the patient's head, and then or on the center of his forehead, and then I will stop the tuning fork and see which side he feels it on more, or if it's bilateral. Okay. Left, right, or in the center?
Center.
Okay. At this point in time, I will now be performing the Snellen eye chart test. Mr. Vang, can you go ahead and stand up for me? With both eyes, what is the lowest line that you can see?
9.
And can you read that line for me?
LEFODPCT.
Okay, go ahead and cover your left eye for me. Okay.
LEFODPCT.
And cover your right eye.
LEFODPCT.
Okay. Go ahead and have a seat for me. Oh, excuse me. I'm sorry. Please stand up. Patient does appear to have 20/20 vision bilaterally. At this point in time, I will also assess his gait. Please go ahead and take a couple steps towards me. Okay, turn around and walk back. Okay, you can go ahead and have a seat. Patient does appear to have steady gait. In a clinical setting, you would obviously have the patient walk a little bit further and back to you to assess the gait. At this point in time, I will now be assessing patient's lungs, anterior and posterior lung fields. Excuse me, prior to assessing his lungs, I would be assessing the bilateral carotid pulse and then assessing for jugular vein distension. Okay, so pulses are equal bilaterally. No jugular vein distension noted. And I would also be assessing range of motion in the neck prior to moving down into the torso. Go ahead and turn your head to the left. Turn your head to the right. Put your head down. Go ahead and make a circle. Okay. And then go ahead and push up against my hands. Okay. So patient does appear to have strong range of motion in the neck and head. And then he does meet resistance against my hands bilaterally. Okay, now at this time, I will go ahead and assess the anterior and posterior lung fields. Breathe in and breathe out. Deep breath in and out. Go ahead and breathe in and out. Okay, lung fields anterior and posteriorly are clear. I will now be assessing the radial pulse. And I would be assessing this pulse for 1 minute. Okay, patient has a strong radial pulse. I will now have you relax your arm and I will be assessing the brachial pulse. Okay, patient has strong brachial pulse. Mr. Vang, I will now have you go ahead and stick both arms out for me and grab my fingers as tight as you can. Okay, patient has equal grip strength bilaterally. I will now be assessing the nail beds. There is no sunken nails. Nails appear to be clean and intact. I will assess capillary refill bilaterally. Left hand is less than 3 seconds. Right hand is less than 3 seconds. Now I'm going to have you lift your left arm, bring it down. Same with your right arm, bring it down. Okay, up and down. Range of motion is strong in both upper extremities. Okay, Mr. Vang, I am now going to have you lay down. At this point in time, I will be assessing the apical pulse, observing for any abdominal distension or tenderness in the abdomen, as well as assessing his bowel sounds. So I will start with the apical pulse, which is located below the fourth intercostal space. Okay, patient has a strong apical pulse. I'm now going to palpate all 4 quadrants of the abdomen. If you have any pain, please let me know. Okay, abdomen is soft and non-firm, non-tender. So everything in the abdomen feels okay. I will now be assessing his bowel sounds. I will be assessing for 1 minute in each quadrant as well. Okay, bowel sounds are normal active in all 4 quadrants. Mr. Vang, when was your last bowel movement?
Today.
Okay, and are you having any issues with urination or defecation?
No.
Okay. And I will now be assessing the femoral pulse, which is located in the groin. Patient has a strong femoral pulse. I will now be assessing the the popliteal pulse, which is located right behind the knee. Okay, patient has a strong a strong popliteal pulse. I will now move down to the intertibial pulse. Okay, strong pulse. And then the dorsalis pedis pulse. Okay, Mr. Vane, can you go ahead and raise both legs for me? Okay, and then go ahead and kick this leg out. Okay, go ahead and kick the other leg out. Okay, you can go ahead and lower your legs. Now I want you to go ahead and push against my hands bilaterally. Okay, patient has strong movement when pushing against my hands. Now go ahead and push up. Okay, now go ahead and push against my hands. Okay, patient has equal strength bilaterally. Now, the last thing I'm going to do in my assessment, Mr. Vang, if you can go ahead and sit up, I am going to assess his reflexes. I should have done so when the patient was already sitting. I would use like a small tool to go ahead and hit, okay? Strong reflex in the left knee and strong reflex in the right knee. Okay, that concludes the assessment for today. Mr. Vang, I went ahead and did a head-to-toe assessment on you. Do you have any questions for me?
No.
Okay, thank you so much.